Hello, my name is Matthew Diehl.
And my name is Tyler Heberle, and we are brothers of the professional pharmacy fraternity Phi Delta Chi, Beta Gamma chapter from the Milan School of Pharmacy at Duquesne University, located here in Pittsburgh, PA.
In today's episode of Know Your Drug, we'll be discussing Nexium, also known as esomeprazole magnesium, which is commonly prescribed for the treatment of GERD, or gastroesophageal reflux disease, and is also approved by the FDA for the healing of esophagitis, meaning the erosion of the lining of the esophagus caused by stomach acids. Today, we'll be highlighting the importance of using Nexium in the treatment of GERD and esophagitis. GERD is a disease state that causes food or liquid to creep back up into the esophagus, which is the tube connecting the mouth to the stomach, after the food or liquid has already passed into the stomach. This occurs usually because of a problem with a band of muscles at the base of the esophagus called a sphincter, which opens and closes to allow food to pass through. But if it doesn't close all the way, the stomach acids may come back through. When this food or liquid comes back out of the stomach into the esophagus, it brings with it extremely acidic stomach juices. When this happens, it causes extreme discomfort and irritation of the esophagus, and thus heartburn and other symptoms. These other symptoms include regurgitation of food, coughing, nausea and vomiting, and persistent belching. Nexium is a member of a class of drugs known as proton pump inhibitors, or PPIs, which act on the glands in the lining of the stomach, which produce digestive acids and enzymes. Other drugs in this class include Prilosec, or omeprazole, Protonix, or pantoprazole, and Prevacid, lansoprazole. These drugs all vary in some degree, such as strength, potency, dosing, or duration of action. These proton pump inhibitors work by inhibiting the hydrogen-potassium ATPase enzyme pump, which is responsible for producing the acid in the stomach. Once this happens, hydrogen ions, which are responsible for making the gastric juices acidic, are inhibited from being released. By doing this, the pH of the stomach is increased so that any fluids that escape back into the esophagus will be less acidic and less irritating. This in turn can also help your body repair any prior damage from acidic secretions in the esophagus. In addition to medications used to treat GERD, there are some lifestyle modifications that should be utilized in order to aid in preventing symptoms of GERD. Patients with GERD should avoid tobacco and alcohol, chocolate, caffeine, peppermint, orange and tomato products, as well as fried, fatty foods. Patients should also avoid lying down after eating and may want to try elevating the head of the bed while sleeping to keep the body from being completely flat.
Nexium is most commonly taken as a 20 mg or 40 mg dose, once daily, 1 hour before a meal or for 4 to 8 weeks. A second regimen of 4 to 8 weeks may be necessary, and many patients take Nexium and other PPIs long-term for chronic management of this condition. The 40 mg dose is the most common dose, with the exception being for those with severe hepatic liver function problems, as well as for children under the age of 12. When first starting Nexium, it is important to maintain your follow-up visits with your physician to ensure drug effectiveness without serious side effects. These visits may include liver function tests to ensure the drug is not adversely affecting the liver and its enzymes. While taking Nexium, it is important to be aware that some GI side effects, such as diarrhea, abdominal pain, gas, dry mouth, and constipation, have been reported in about 4% of patients in clinical trials. Nexium is well tolerated in most patients, and many side effects are very minor. However, if you experience any of these side effects long-term, speak to your physician or pharmacist immediately for further consultation. If you miss a dose of Nexium, take the missed dose as soon as you remember. If it is almost time for the next dose, skip the missed dose and take the medicine at the regularly scheduled time. Do not take extra medication to make up the missed dose. Some potential drug interactions to be mindful of include the concurrent use of Nexium and Reataz-Varicept, which are drugs used to treat HIV. Other interactions include Nexium and ketoconazole, itraconazole, which are antifungal agents, as well as Nexium and ampicillin, an antibiotic in the penicillin family. Nexium should not be taken with other PPIs or H2 blockers such as Zantac or Pepcid. Notify your doctor or pharmacist of any prescription herbal or OTC medications you take to ensure there are no serious interactions with your medications. If used appropriately, Nexium has been proven effective in preventing gastroesophageal erosion as a result of GERD and also in healing prior GERD damage. Nexium should be used in conjunction with lifestyle modifications to achieve maximum success of therapy.
Always remember, pharmacists are the drug experts. Utilize them to ensure you are receiving the best pharmaceutical care possible, and to know your drug. On behalf of Phi Delta Chi and Duquesne University's Milan School of Pharmacy, my name is Matthew Diehl.
And I'm Tyler Heberle, and this has been Know Your Drug.